My name is Dr. Anthony H. Luick. I'm a psychologist who works with veterans and family members. I am the president and founder of American Veterans Quest for Peace. As such, I bring back veterans to Vietnam and their family members as part of a healing process. I also work with Iraq and Afghanistan veterans and Gulf War veterans who have experienced the trauma of war. I've been asked to comment on vicarious or secondary PTSD. This is a controversial subject because of the primary criteria for diagnosing PTSD. The first and primary condition has to be exposure to the threat of loss of life or the perceived threat of loss of life. Of course, a veteran's family member, son or daughter or wife, didn't directly experience the trauma of war. However, over my years of practice with veterans and working with the sons and daughters of veterans and the spouses of veterans, it's very clear that many of their symptoms parallel those of PTSD, including depression, anxiety, hypersensitivity, sleep disorders, increased suicidal rates, increased perception that they may be in defensive situations. So it's difficult sometimes to distinguish the veteran and his symptoms from the family member and their symptoms. I think the controversy will likely continue. However, whether or not secondary PTSD or vicarious PTSD ever becomes a formal diagnosis in the DSM-5 manual is unknown at this point, but it's certainly something that we as mental health professionals need to be completely aware of in working with the veteran and the veteran family members. I think it's important that we understand the characteristics of our Vietnam veterans and the characteristics of Iraq and Afghanistan veterans. And I really recommend that you go to our website, American Veterans Quest for Peace, where there is a detailed discussion of PTSD and the characteristics of the veterans in the theater of their service. Thank you.